Okay, so now the next video is on Introduction to Dermatology Part 2, in which there is first topic is dermatological investigations. Okay, today we will study dermatological investigations. In the previous video, we learned about the layers of the skin and the associated lesions. Now, the investigations related to it. First of all, we have the Wood's lamp. Okay, in Wood's lamp, the wavelength used is 365 nanometers. We can remember it from the movie 365 days. I'm sorry, but nice way of remembering. Then we have filters which are used. In filters, BSNO is used, that is barium silicate, 9% nickel oxide. Okay, barium silicate. Obviously, barium will be used. Barium silicate, obviously, because it gives fluorescence. Okay, that is why barium silicate is used along with some oxide, such as 9% nickel oxide. Now, this is the image of a Wood's lamp. Okay, usually in Wood's lamp, bluish fluorescence is seen. Okay, and it is used in tinea capitis to detect tinea capitis. Now, how Wood's lamp is used to detect tinea capitis? This is the image in which bluish fluorescence is there. Okay, Wood's lamp is used to detect bluish tinea capitis with the help of bluish fluorescence. After Wood's lamp, we come to the potassium hydroxide test. First test was the Wood's lamp. Now we have the potassium hydroxide test. In potassium hydroxide test, okay, it is the investigation of choice in suspected superficial fungal infection. Okay, it is the investigation of choice in suspected superficial fungal infection, potassium hydroxide. And skin scrapings are examined under the microscope in this case, and the demonstration of hyphae or spores, it indicates fungal infection. Okay, in potassium hydroxide test, okay, it is investigation of choice in suspected superficial fungal infection. Wood's lamp was a investigation of choice in tinea capitis. Now in potassium hydroxide test, skin scrapings are examined under the microscope, and there is demonstration of the hyphae or spores. Now, just an image of skin scrapings like this. Skin scrapings, they are taken off in case of any kind of suspected superficial fungal infection, and there is demonstration of hyphae or spores in the fungal infection. After potassium hydroxide test, we have the Zank smear. First of all, we had Wood's lamp, then potassium hydroxide test, then Zank smear. Now, okay, in this case, let me insert the image first. In case of Zank smear, this is the image in which Zank smear is being taken. Now, in case of Zank smear, okay, it is a special term is used for Zank smear, which means the roof a vesicle. It means removing the upper superficial or the roof of the vesicle, okay, or any fluid filled substance filled vesicle, in order to examine the contents under a microscope. Okay, now what are the stains used? The stains used in this case are Giemsa stain. Okay, now after this, Giemsa stain is used while staining. Now, what are the acantholytic cells or Zank cells? These are the round cells with a large nucleus seen in pemphigus group of disease. Okay, now an image of desmosomes. Now what is seen in desmosomes? Okay, now this is the image of those Zank cells in which desmosomes are present. Here desmosomes are present. Okay, I can also see some of the multinucleated joint cells. Okay, in Zank smear we can see Zank cells which are round cells with a large nucleus seen in pemphigus group of disease, and they have desmosomes. Now after this, in Zank smear, first we saw the procedure, then the observation. In observation we see Zank cells, and we also see multinucleated giant cells. We also see multinucleated giant cells which are seen in varicella and HSV infection. which are seen in varicella and HSV infection. These are those kind of multinucleated giant cells which are seen in HSV or varicella infections. After Zank's smear, first of all we studied the Woods lamp, then we studied the potassium hydroxide test, then Zank's smear, then we will come to the diascopy. In diascopy, we press skin with a glass slide. Okay, in diascopy we press skin with a glass slide, and there is erythema, which means blanches on diascopy. Okay, now what happens to erythema on diascopy? It blanches. Blanches means it kind of disappears on diascopy. For example, in the image we can see it over here. Okay, in cases of erythema, okay, this is the case of erythema in which there is blanching seen on diascopy. But in case of extravasation of blood, like this, okay, in case of extravasation of blood, it includes petechiae. For example, what are the examples of extravasation of blood? We have petechiae, purpura, and ecchymosis. In these cases, they do not blanch on diascopy. Okay. In cases of extravasation of blood, it includes what are the cases in which extravasation of blood is seen? It is petechiae, purpura, and ecchymosis. They do not blanch on the diascopy. After this, coming to patch test. Now, patch test. It is the investigation of choice in ACD, allergic contact dermatitis. Patch test. It is the investigation of choice in ACD, that is allergic contact dermatitis, and the most common site in this case is upper back. First reading is done after the 48 hours. In the case of patch test, for patch test, the most common site is the upper back, and the first reading is done after 48 hours usually, and the best reading, it is done after 96 hours. Around after 4 days. In patch test, usually it is done after 3 days, but best reading is after 4 days. Sorry, 2 days over here. It is a measure of type 4 hypersensitivity reaction, and it is a type of delayed hypersensitivity. Okay, patch test is the investigation of choice in allergic contact dermatitis, and the most common site is upper back. First reading is done after 48 hours, best reading after 4 days, and it is a measure of type 4 hypersensitivity reaction. Delayed hypersensitivity is seen. I think I don't have the image of patch test right now. Maybe it skipped. Okay, so this is the image of patch test. Okay, in this, type 4 hypersensitivity or delayed hypersensitivity is checked, and the most common site is upper back. After this, coming to the pathology test. In this case, what happens? Patient develops a papule or a pustule or vesicle at the site of prick. Okay, a papule or a pustule or a vesicle is seen. Now, what are papules, pustules, or vesicles? For this, you have to refer to the previous video. Okay, now also a sterile needle is used to demonstrate this test. Positive in pathology test. It is positive in SBP. Pathology test is positive in, we can remember it from the mnemonics, sorry BP. Okay, it is positive in Sweet syndrome, Behçet's disease, and pyoderma gangrenosum. Okay, pyoderma gangrenosum. This is a kind of pathology test in which a papule, pustule, or vesicle at the site of prick it develops, and the sterile needle is used to demonstrate this test. It is positive in Sweet syndrome, Behçet's disease, and pyoderma gangrenosum. Now coming to the next tests, which are the skin biopsy. In skin biopsy, it is of different types. First of all, we have the shave biopsy, then we have the punch biopsy, and then at last we have the excisional biopsy. Shave, punch, and excisional. we are gonna look at the images only. This is the shape biopsy. Then we have, this is the punch biopsy, in which skin a lesion is punched out. And then at last we have the excisional biopsy. Now looking at the excisional biopsy closely, we can see that this is the incision margin. Okay. Then we have the safety margin of normal skin. This is the incisional margin. This is the safety margin of normal skin. This is the skin lesion in excisional biopsy. After skin biopsy, going to the, just looking at the histopathology of normal skin first. Just revising a bit. This is the histopathology of normal skin. Just a bit overview. Now, how we will come to know whether this is the histopathology of normal skin. For this, let us revise some of the layers again. Coming to the first layer of the skin, that is the stratum corneum. Okay, in stratum corneum, normally there is basket weave appearance. Okay, normally there is basket weave appearance. Now, how is the normal stratum corneum? It is like this. That is the basket weave appearance. Okay, this layer over here is the stratum corneum. Okay, basket weave appearance is seen. And in case of hyperkeratosis, what happens is there is increased thickening of stratum corneum in hyperkeratosis. Hyperkeratosis is seen in psoriasis. Okay, after this, coming to the parakeratosis. There is presence of nucleus in stratum corneum. Example, again in psoriasis. Okay, in hyperkeratosis, again there is increased thickness of stratum corneum. Example, psoriasis. And in parakeratosis, there is presence of nucleus in the stratum corneum. Again, the example is psoriasis, but in this case benign psoriasis. Or Bowen's disease, in case it is malignant. Now note, parakeratosis, okay, it is a normal finding where in the vaginal or the oral mucosa. It is a normal finding in the vaginal or the oral mucosa. Okay, stratum corneum is done. Now coming to the rest of the layers, we can see this is again stratum corneum, so not very well demarcated over here. Let's look at the other layers over here. Okay, this is stratum corneum. After this, lucidum is seen in thick skin at the soles and palms. Just leave that for now. Then see the stratum granulosum. Okay, this layer is stratum granulosum, and this whole layer is stratum spinosum. Now coming to stratum granulosum. This is the normal stratum granulosum. Okay, now there can be again two cases like hyperkeratosis and parakeratosis we saw earlier. Now in this case there is no paragranulosis, there is hypergranulosis and hypogranulosis. Hypergranulosis and hypogranulosis. In hypergranulosis there is thickening of stratum granulosum. Example, in case of lichen planus, in hypergranulosis there is thickening of the stratum granulosum. Example, in case of lichen planus. And in hypogranulosis there is thinning of stratum granulosum. Example, psoriasis vulgaris. In hypergranulosis there is thickening of the stratum granulosum. Example, lichen planus. In hypogranulosis there is thickening of the stratum granulosum. Example, psoriasis vulgaris. Okay, hyperkeratosis and parakeratosis is seen in psoriasis. Parakeratosis and psoriasis benign, and hypogranulosis is seen in psoriasis vulgaris. Now coming to the layer next layer, that is stratum spinosum. Okay, just a second. Now coming to the next layer, that is stratum. Now coming to the next layer, that is stratum spinosum. It is the thickest layer of epidermis. Stratum spinosum is the thickest layer of epidermis, and it is normal. This over here is a normal layer. Now there can be acanthosis and acantholysis. We use the term acanthosis and acantholysis instead of hyper and hypo. There can be acanthosis and acantholysis, such as in acanthosis there can be thickening of stratum spinosum. There can be thickening of stratum spinosum. Example in case of lichen planus. And there can be hypergranulosis too in case of lichen planus. Acanthosis and hypergranulosis is seen in lichen planus. And acantholysis, it is the separation of keratinocytes in HPE. There is separation of keratinocytes in HPE. Again, the example in this case is vulgaris only, but in this case it is pemphigus vulgaris. Example in this case is pemphigus vulgaris. There is separation of keratinocytes in HPE. Then coming to the next topic, that is rete ridges. Now what are rete ridges? Regular, it is the wavy pattern between the epidermis and dermis. And regular elongation. Regular elongation, it is seen in camel foot rete, that is psoriasis vulgaris. Okay, it is seen in camel foot rete, psoriasis vulgaris. Regular elongation is seen. Now inserting, I don't have the image of rete ridges. We saw it in a previous video only. After this we have sawtoothing. Sawtoothing is seen in, is somewhat like this, and it is seen in lichen planus. Sawtoothing is seen in lichen planus, just like acanthosis and hypergranulosis. Then microabscess can also be seen, which is the collection of cells. Okay, which is the collection of cells. Okay, in this case okay, so in this case the cells, they can be neutrophils, okay, they can be lymphocytes, they can be neutrophils, they can be lymphocytes, and they can be eosinophils. They can be neutrophils, lymphocytes, or eosinophils. In microabscess, if they are neutrophils, okay, neutrophils in rete ridges, they are seen in psoriasis, and in dermatitis herpetiformis. In psoriasis there is Monro micro abscess, and there is pustule of Gogoj, that is spongiform pustule, and there can be papillary tip micro abscess. In neutrophils, if there is collection of neutrophils in the rete ridges, then it is due to psoriasis or dermatitis herpetiformis. In case of psoriasis, Monro microabscesses are present. Okay, Monro microabscesses, and Monro microabscesses and pustule of Gogoj is the example in which spongiform pustules are there. In dermatitis herpetiformis, there is papillary tip microabscess, not Monro microabscess. In lymphocytes, there is Pottier's microabscess, or there can also be T cell lymphoma, as in case of mycosis fungoides. And in eosinophil collection, it is seen in pemphigus vegetans. Okay, neutrophil collection is seen in psoriasis and dermatitis herpetiformis. Lymphocyte collection is seen in Pottier's microabscess. Eosinophil collection is seen in pemphigus vegetans. Okay, till now we studied regular elongation, sawtoothing, and microabscesses. Microabscess is just a collection of cells. And after this we have ballooning and spondiosis. In ballooning and spondiosis, ballooning we have intracellular edema. In ballooning there is intracellular edema, that is why ballooning is there. Example is again HSV varicella. In spondylosis, there is again intracellular. Okay, in this case, there is intercellular edema, which is the hallmark of acute eczema. Okay, it is the hallmark of acute eczema, spondylosis. Now, inserting the images. Okay, so I don't think we can add more images. Let us just give a short review of what we have studied till now. Till now, we had covered Wood's lamp. That was easy. The example of Wood's lamp is tinea capitis. Potassium hydroxide test is done in superficial fungal infection. Zank smear, it is done in varicella and HSV infection. Okay, ballooning is seen in HSV and varicella infection, and also Zank smear is done in the same. Then diascopy. Okay, diascopy in petechial purpura ecchymosis or erythema, patch test. Typhoid, it is seen in ACD. Pathology test. For this, we had a mnemonic SPP, sweet syndrome, Behçet's disease, and pyoderma gangrenosum. Skin biopsy was of the following types: shape biopsy, punch biopsy, and excisional biopsy. And histo of normal skin and related pathologies with each layer, lateral ridges and the related pathologies. Okay, now for the images. I think that we'll have to clear this all. Okay. Now the images of ballooning and spondylosis. This is the image of ballooning. Okay, it is seen in HSV and varicella. So Zank smear can also be taken. This is the ballooning, which is the intracellular edema. And in case of spondylosis, we have this. Okay, it is the hallmark of acute eczema. In this, there is acute eczema. Okay, in this, there is intercellular edema. Intercellular edema. Now coming to cell lines, which is the last topic. Cell lines, which is the last topic for today. In cell lines, we will cover different types of cell lines. First of all, we have Glasgow's lines. Then we have Langer's lines, Glasgow's lines, Langer's lines. Then Wallace lines, Glasgow lines, Langer's lines, Wallace lines, and then at last Krazel lines. Okay, Glasgow's lines. These are the invisible. Okay, remember invisible cell development lines. These are the invisible cell development lines. HIE is the mnemonic. H stands for hypomelanosis of Ito. Hypomelanosis of Ito. Okay, these are seen in sometimes these invisible cell development lines. Okay, they become visible in case of the mnemonic is HIE, high. Okay, hypomelanosis of Ito, incontinentia pigmenti. Then here incontinentia pigmenti, and epidermal nevus. Okay, hypomelanosis of Ito, incontinentia pigmenti, hypomelanosis of Ito, incontinentia pigmenti, and epidermal nevus. Hypomelanosis of Ito, incontinentia pigmenti, and epidermal nevus. Now, not this one actually, I'm sorry. I think I downloaded the image. Okay, just a second. So these are the Glasgow's lines, which are seen in hypomelanosis of Ito, incontinentia pigmenti, and epidermal nevus. Usually they are invisible. Then we have Langer's lines. Let us look at the Langer's lines. These are the Langer's lines. These are important surgical lines. Okay, Langer's lines are important surgical lines. And in this case, incision is given parallel to the Langer's lines, as there is less scarring and better wound healing. Okay. Now these are the Wallace lines. These are we can see it over here. They are visible. Okay, and these are the demarcation lines. These are usually more visible on the foot. Then we have the Krazel's line. Krazel lines, they coincide with the wrinkle lines, and these are the Krazel's lines. They coincide with the wrinkle lines. So that's all.